Hi, good morning. Welcome to the first in a series of webinars the Workers' Health and Safety Center is hosting on worker health and safety issues related to COVID-19. I am Tina McPherson, a Senior Program Development Officer with the Workers' Health and Safety Center, Ontario's only designated health and safety training center successfully operating now for more than 30 years. I'd just like to take a moment to mention, I do see that some hands are being raised, and unfortunately, other people participating in the webinar are unable to hear you. So what I would ask is that you send any questions through the Q&A chat, and we will handle all questions at the end of the webinar. We've been working hard to answer your COVID-19 questions individually and through information posted on our website. Today, we are looking to expand our reach further still, all in an effort to help safeguard essential workers who continue to work outside the safety of their homes during these challenging and unprecedented times. So let's get started. Effective cleaning and disinfecting of workplaces is critical to controlling COVID-19. In this presentation, we will consider good practices for various surfaces to be cleaned, the difference between cleaning and disinfecting, choosing disinfectants and other cleaning supplies, and safeguards for workers actually doing the cleaning. Please note, the information we provide in this presentation is based on the collective advice of public health authorities in Canada and the United States. These recommendations covered in this presentation apply to those required to clean and disinfect rooms or areas of workplaces deemed essential, especially those visited by the public, such as grocery stores, pharmacies, restaurant pickup, hotels, gas stations, and laundromats, to name a few. These recommendations are not intended to cover healthcare facilities. Evidence suggests the COVID-19 virus may remain on surfaces from hours to days. In order to prevent the spread of these microorganisms, cleaning followed by disinfecting surfaces is a best practice measure for prevention. Of particular importance are frequently touched surfaces. Frequently touched surfaces in community settings include handles, counters, handrails, touchscreen surfaces, light switches, tabletops, carts, food contact surfaces, to name a few. These frequently touched surfaces should be cleaned and disinfected at least twice per day and when dirt is visible. It's important to distinguish the difference between what is cleaning and what is disinfecting. Cleaning is the process of removing dirt and impurities from surfaces. Cleaning does not kill germs such as the COVID-19 virus. Disinfecting is the process of using chemicals to kill germs that remain on a surface. Disinfecting does not necessarily clean a surface. Rather, it kills germs that remain on a surface after cleaning. In order to clean and disinfect, choosing effective products is critical. To clean a surface, a detergent or soap with water should be used. To disinfect a surface, you should use a Health Canada or US Environmental Protection Agency registered disinfectant such as Lysol disinfecting wipes, Clorox multipurpose cleaner, or Clorox disinfecting wipes. At the end of this presentation, I will refer you to Workers' Health and Safety Center resources so you can look to see if the products you currently have available are registered with either Health Canada or the US Environmental Protection Agency registered products deemed to effectively kill the COVID-19 virus. If you have a product available that is not on the registered Health Canada or EPA list, it may still be effective. Have a look at the label or safety data sheet for active ingredients. The following concentration of active ingredients have been tested as most effective: 62 to 71% ethanol, also known as ethyl alcohol, 0.5% hydrogen peroxide, or 0.1% sodium hypochlorite, which is bleach. If you don't have a pre-measured disinfectant at your disposal, that's okay. You can prepare a bleach solution of your own, but please take great care when you do. In fact, you should be properly trained to do so first. To prepare your own bleach solution for disinfecting, mix 5 tablespoons of bleach, or 1/3 cup of bleach, per gallon of water, or 4 teaspoons of bleach per quart of water. Please note, bleach should never be mixed with ammonia or any other cleaner. Actually, do not mix any cleaning chemicals, as they may create a hazardous or even deadly gas. Also very important, ensure the bleach you are using is not expired, as it may not be effective. Whether you are using a common household disinfectant, a medical grade disinfectant, or a bleach solution, all are hazardous products. When hazardous products are used in a workplace, the employer must provide workers with globally harmonized WHMIS training, and a safety data sheet for each product must be readily available. WHMIS training must result in workers being able to use information required by WHMIS to protect their health and safety, as per Section 7, subsection 3 of the WHMIS regulation. This training must also be developed and implemented in consultation with the Joint Health and Safety Committee or Health and Safety Representative. Please ensure that you always follow manufacturer's instructions for all products, such as the recommended dilution, material compatibility, storage, shelf life, and safe use and disposal. With all your products gathered, now we can look at what next you should do before you start cleaning and disinfecting. Firstly, it's important to ventilate the area. Ventilation is needed to minimize exposure to respiratory droplets. If possible, you should open outside doors and windows to increase air circulation and/or increase the building's air exchange rate. You should wait 30 minutes before you start cleaning. Very important, in areas where someone has worked or visited and has been identified as a person suspected, presumed, or confirmed as infected with COVID-19, you should wait at least 24 hours before cleaning and disinfecting. For all cleaning tasks, including handling trash, workers should be supplied with gloves that are compatible with the disinfectant in use, so see the safety data sheet and ensure proper fit. They should also be provided with gowns, and if gowns are not available, then coveralls, aprons, or work uniforms are okay. They also need face shields if there's a potential for splash, and lastly, shoe covers or dedicated shoes that can be decontaminated. Prior to any cleaning tasks, training on proper use and limitations of personal protective equipment should be provided, including putting on and removal of PPE, proper disposal, and how to properly clean, decontaminate, and maintain reusable PPE after and between uses. Workers, it's so important that you always inspect your PPE and immediately report any issues to your supervisor. You want to look for things like a tear in the glove or any potential exposures. At this point, you have your products, you've reviewed their SDSs and manufacturer instructions, you've opened doors and windows where possible, and you've been trained and are wearing your PPE. So now is when you can start. For hard surfaces, use soap and water, wipe the surface using friction with a disposable or microfiber cloth. Tests have shown that microfiber cloths tend to be more effective at cleaning and disinfecting than terry or other types of cloths. It is important to ensure that the cloth stays clean by using a new cloth or a fresh portion or quadrant of the cloth for each area or surface. Once all portions have been used, the cloth should be replaced. If you're using reusable cloths, it may be a good idea to color code the cloths. For example, you could use red for bathrooms, green for frequently touched surfaces, and blue for glass or reflective surfaces. It's important to ensure that only one set of cloths is used per room or area to avoid cross-contamination. It's important not to forget about soft surfaces such as linens and cushions. Fabrics that are potentially filled with germs like COVID-19 should be washed in hot water with detergent and dried on the highest temperature setting available. For non-washable soft surfaces like carpets or furniture, you can apply a disinfectant spray. Electronics are often frequently touched surfaces, including touchscreens, keyboards, ATM machines, and remote controls. If possible, it's best to use covers that can be easily wiped. If you do not have these, you need to ensure that you follow the manufacturer's instructions. And if cleaning instructions aren't available, use an alcohol-based wipe or spray that have 70% alcohol, and then dry the surface thoroughly so there's no damage to the electronics or pooling of water. I think it's very important to talk about disinfecting wipes that have been flying off the shelves during this pandemic. While these wipes are very handy, like all disinfecting products, be sure to check if they are registered as COVID-19 effective with the Health Canada or US Environmental Protection Agency lists. If not, again, check their active ingredients. It is also important that they are used correctly. Firstly, you should always clean a surface prior to using disinfecting wipes. Check your container as they all indicate how long the surface must stay wet, which is usually 4 to 10 minutes to be effective. If you grab a wipe and give a counter a quick swipe, you may be doing more harm than good. You may just be smearing the pathogens around. So clean first, and then you will probably need more than one wipe to ensure the surface stays wet for the recommended amount of time. Please note that dry wipes should be discarded as they are no longer effective. Cleaning also includes removing waste or emptying waste bins. Things such as discarded cloths, gloves, or tissues in waste bins may contain the COVID-19 virus, so care must be exercised. Waste bins should be lined with plastic, and ideally, waste bins should be non-touch or open. After you've removed the bag of trash, you should clean and disinfect the wastebasket, or at a minimum, spray it with a disinfecting spray. Once you are finished cleaning and have emptied waste bins, the waste bin and all equipment used, such as brooms, mop handles, and that sort of thing, must be cleaned and disinfected. Broom or mop handles can be cleaned and disinfected as you would a hard surface, and cloths that were used should be discarded, or if they are reusable, place them in a bag until they can be laundered. PPE, such as gloves and gowns, should be removed properly and immediately disposed of in an empty plastic-lined, non-touch waste bin. If using reusable gloves, they should be properly cleaned and decontaminated. It is imperative that you immediately wash your hands with soap and water for at least 20 seconds after removing gloves. If soap and water aren't available, then you should use a hand sanitizer with at least 60% alcohol. Ethyl or isopropyl alcohol would be sufficient. Workwear worn should be laundered daily, and as an added precaution, you may want to remove workwear and place it in a plastic bag until it can be laundered. Thank you all for joining today. I hope you found this information useful and that it serves to assist in protecting our essential workers during this difficult time. I'm going to ask, I have a poll that I'm going to send out, and I'm going to ask that you take this short survey and submit it. Your answers would be mostly appreciated. So I'm just going to launch this poll here. I will take questions, but for more information, please be sure to visit our COVID-19 resource page. There you will find a number of related documents, including a document on evaluating disinfectants, which provides details and links to the lists of registered disinfectants with Health Canada and the US Environmental Protection Agency. Some other useful information you will find on our COVID-19 page includes workers' rights resources, gloves at work, which are safeguards for workers, a page on confronting COVID-19, another on respiratory and eye protection at work, safeguards for workers confronting COVID-19, cleaners and janitors confronting COVID-19, cleaning and disinfecting confronting COVID-19, and laundering workwear. Thank you all very much. And at this time, I will take questions if there are any. It's going to be somewhat tricky as I can't hear any of you. So you do have to submit your questions through our Q&A. Okay, so I have one question here. Is it okay to hang dry clothing after washing, or does it have to be dried in a hot dryer? I can't say for sure that whether it would be okay or not to hang dry clothing. What is recommended is that it is fully dried at the highest temperature available. Sorry, I'm just taking a look here through some of these questions. Okay, we have another question here. Why should we wait 24 hours before starting cleaning an infected area? The reason for doing that is you should open doors and windows to ventilate the area, or increase the building's ventilation if possible, or air exchange rate. And the idea is to get rid of those respiratory droplets before a cleaner goes into a room to start cleaning and disinfecting. So that's for your protection as a worker. There's a few questions here about ventilating an area and waiting for 24 hours. I think I just answered that. That's for your protection. I think ventilating is also important too when you're using disinfectants that can be hazardous, such as bleach. Ventilation is very important. Question here, if soap and water are effective for washing your hands, why is disinfecting required after cleaning surfaces? So the idea is that cleaning does not kill germs. What it does is it removes them. So when you use a soap or a detergent with water, you are removing the germs. When you have a hard surface or a frequently touched surface, you need to clean to get rid of the visible dirt and remove as many germs as possible. But then you go and you disinfect those frequently touched surfaces to kill any germs that remain on the hard surface. A question here about training requirements for disinfecting and cleaning workers. Yes, there would be training requirements if you are working with a disinfectant, which is, while disinfectants are effective and they are safe tools when used properly, they can also be hazardous. Disinfectants can have dangerous properties that are potentially hazardous to workers, such as ethylene oxide, which is highly flammable and explosive. So if you are working with hazardous products, you are required to have globally harmonized WMIS training, and you must also be trained on PPE that you are required to use. A question, can I please explain why a surface needs to be kept wet for so long when disinfecting? What you need to do is read the manufacturer's instructions or the safety data sheet for the disinfectant that you are using. If you have a bottle of Lysol wipes at home right now, if you take a look on the back at the manufacturer's instructions, it will indicate how long it needs to remain on a surface. And that's because of the what the disinfectant contains. It takes that long of a period of time for the disinfectant to remain on the surface to actually kill the germs. And this can vary. Some medical grade disinfectants can indicate that they can kill germs within 1 minute, whereas I think if you look on several Lysol or Clorox disinfecting wipes, I think what you will find is the manufacturer indicates that it takes between 4 to 10 minutes. There are some questions coming in here, and some really great questions that I can't necessarily answer off the top of my head, or I can't provide the resources that would be needed at this moment. But we would be happy when you submit your questions, if you don't get your answer today during this webinar, if you would provide contact information along with your question, we will do our very best to get back to you and provide you with the information that you need. Questions around PPE, not being able to obtain it. I would suggest that you speak with a member of your Joint Health and Safety Committee. Sorry, I'm just filtering through the questions. A lot of them are repeats. To Derek, your question, yes, I'm just reconfirming. It suggested that you wait 24 hours to begin cleaning. Once you ventilated the area, you wait 24 hours in an area where a suspected person or confirmed person with COVID-19 was, and 30 minutes for other areas. Question, after cleaning and disinfecting, is it sufficient to sanitize your hands, or must they be washed thoroughly? It's recommended if you have soap and water available, it is recommended that you wash your hands. That process should take at least 20 to 30 seconds. So washing your hands is best and the recommended way to go. If you don't have access to hand soap and water, then using a hand sanitizer with 70% alcohol would be your next best option. And again, it's also important when using hand sanitizer to do it properly, just like there's hand hygiene for washing your hands, that also exists for hand sanitizer and how it's applied correctly. Again, sorry, just be patient. I'm scrolling through questions to see what I can answer. Question, why does alcohol have to be 60% or more? Are there products with less than 60%? That I don't know. There could be products with less than 60%, but 60% is the recommended uh, alcohol that should be in a product to adequately disinfect. Lots of questions about opening doors and windows in workplaces where windows are sealed. Obviously, if windows are sealed, there's nothing you can do about that, but you do want to open whatever doors you can. Again, this is all if possible. If you can open the window, you should. Otherwise, if you can't, you want to ensure that you're not in an enclosed room with the door closed while cleaning and disinfecting. So if you can, at least open the door. Questions around how often you should be cleaning and disinfecting, what's recommended through public health on visible surfaces or frequently touched surfaces is at least twice a day. So in that situation, you're going to clean and then disinfect at least twice a day. And you may want to, use those disinfecting wipes in between that regular twice daily cleaning. Questions around laundry. I would suggest that you refer to our COVID-19 page, as there is a fact sheet there on laundering workwear. One tip that I can give, laundry should never be shaken. But take a look at that resource sheet, and I think you'll find some useful information there. Question about cleaning and disinfecting products, wondering if they're effective that don't contain alcohol or bleach. Um, that I don't know for sure. What I would recommend is, again, go to our COVID-19 page, and we do have a document there on effective disinfectants, and that will take you to the list that Health Canada and the EPA have provided that are deemed safe and effective for COVID-19. Question about the frequency of disinfecting. It says regular touch surfaces, but what's recommended for frequently touched surfaces would be twice a day cleaning and disinfecting, and that twice a day or minimum of twice a day, or if visibly dirty or soiled. More questions around hand washing and soap. Again, I would refer you to the Workers' Health and Safety Center COVID-19 page, and there you will find a resource on hand hygiene. I'm seeing lots of questions about the list for registered chemicals and disinfectants. So again, please go to the Workers' Health and Safety Center webpage or website and go to our COVID-19 page, and there you will find a page on disinfecting and effective disinfectants, and that will take you to the EPA and Health Canada lists of disinfectants deemed effective for COVID-19. Unfortunately, that's all the time that we have for questions today. I still see that there are tons more. I did my best to answer what I could. Lots of really good, important questions here. So as I suggested earlier, please, if you could provide a means of contacting you, we will do our best to get answers to your questions and get back to you. So thank you all for joining today. Please check out the Workers' Health and Safety Center website, and there you will also find future webinars that are scheduled. Thank you so much, everyone. Stay safe.